Welcome to the Omni Dental Podcast. Today we are doing a deep dive into what might be the most advanced way to replace a tooth, the dental implant.
For sure.
And it's not just a physical thing, it's really a biological commitment. People call them the gold standard, and they are, but here's the key thing we found in our research. The success of the procedure, which, can cost thousands, it's a partnership. The dentist performs the surgery, but it's really you who determines the final outcome.
That is absolutely the truth. And our mission here is to get past the obvious advice. We want to distill the really essential, critical info on the 5 most common mistakes people make.
And these aren't just small things.
Not at all. These are biological missteps, procedural mistakes that can compromise the entire foundation, that process of osseointegration. We're going to cover everything from how your body heals to the pretty surprising role your overall health plays in all this.
Before we get into those 5 big pitfalls, let's just quickly set the stage for where this advice is coming from. These insights are really drawn from the comprehensive care model you see at places like Omni Dental and Medspa in Arlington Heights, Illinois.
Right. And the fact that they combine advanced dentistry with a Medspa, that tells you a lot about their whole philosophy.
How so?
They see oral health and, aesthetics as completely interconnected, so they're not just doing routine things like deep teeth cleaning or crowns. They specialize in really complex cases.
Seems like full arch dental implants.
The full arch. All on 4 implants, exactly.
And for anyone listening, all on 4 or full arch, that's when you replace a whole set of teeth, top or bottom, with just a few implants. These are, they're life-changing procedures.
Huge. And they require so much expertise, including the prep work like bone grafting. It's all overseen by leaders in the field like Dr. Bayless Poles.
And that Medspa part is interesting, too. They're offering advanced aesthetic services.
Injectables like Botox, fillers, skin treatments.
Tiger facials, laser pigmentation removal. It signals they're not just looking at the teeth in isolation.
Precisely. They're thinking about the whole facial structure, how your smile aligns with your features. And this holistic view is key because, as we're about to discuss, implant success really depends on the health of the entire system.
And just for our listeners, Omni Dental provides this kind of care throughout Arlington Heights and all the nearby communities.
Right, so Buffalo Grove, Palatine, Mount Prospect, Schaumburg, Wheeling, and a number of others.
Okay, let's transition into the core of this. The common failures that can just sabotage this huge investment. We should start with what happens right after the surgery.
Yes.
Mistake number 1, which really seems to compromise the very foundation of the implant itself.
It does. Mistake number 1 is simply not following post-surgery instructions. Strictly.
And this is where that critical process starts, right?
Osseointegration.
Exactly.
It sounds technical, but all it means is that biological fusion. The titanium implant actually becoming one with your jawbone.
So what's the number 1 thing someone can do physically that messes that up?
Micro-movement. The sources are really clear on this. Avoiding sticky or hard foods isn't just about managing pain.
Okay.
It's about stability. If you chew something hard too soon, the implant shifts, even just a tiny bit. That micro-movement tells your body to form scar tissue around it, not new bone cells.
Oh, wow.
And if that happens, if osseointegration fails, the implant is essentially just floating in soft tissue. It's not anchored. Failure is pretty much inevitable at that point.
That completely changes how you think about it. It's not about pain, it's pure biology. Okay, let's go to mistake number 2. Poor oral hygiene. This one feels obvious, but I'm guessing the consequences for an implant are way worse than for a natural tooth.
They're more insidious. People think, oh, it's an artificial crown, it can't decay.
Right.
But the real danger is something called peri-implantitis. This is the implant version of gum disease, and it is the single biggest reason for late-stage implant failure.
Wait, peri-implantitis, what does that actually do to the implant itself?
Well, unlike gingivitis on a normal tooth, which can often be reversed, peri-implantitis creates this chronic inflammation in the gums right around the implant.
Okay.
That bacterial infection starts to attack the bone that's holding the implant in place. It causes irreversible bone loss. And since the implant depends entirely on that bone anchor...
Once the bone is gone, the implant has nothing to hold on to.
Exactly. It loses its support and eventually fails. You have to be so vigilant about cleaning the tissue around the implant, or you literally lose its foundation.
This is where our deep dive really gets interesting, I think. We're moving beyond the mouth and into how your whole body plays a role.
Yes.
Let's talk about mistake number 3. Not providing a full medical history. It seems like it should be a no-brainer, but I guess people tend to separate their dental health from everything else.
They do, and that's a huge risk. An implant isn't just a piece of hardware in your jaw. Its success depends on your body's ability to heal and, accept it.
So giving that full history before the surgery isn't just a formality.
It is absolutely non-negotiable.
The sources mentioned a few major systemic red flags. Can you break down how a condition like, say, diabetes or an immune disorder can actually derail the whole process?
I can. Take uncontrolled diabetes. It impairs your vascular system, which reduces blood flow.
Okay.
That means less oxygen and fewer nutrients are getting to the surgical site. This dramatically slows down the bone regeneration you need for that osseointegration we talked about.
It all connects.
And with immune system disorders, whether they're overactive or suppressed, your body might either try to reject the titanium as a foreign object, or the healing just crawls along so slowly that the site is left open to infection. The success rate for implants plummets if these conditions aren't managed properly from the start.
That connection is just profound. Okay, let's shift to mistake number 4. Not scheduling regular checkups. This is the classic, I feel fine so I don't need to go. What are the silent threats we're missing?
The things that cause implants to fail are often totally asymptomatic until it's a catastrophe.
So you don't feel any pain.
Right. You need a professional because they're monitoring things you can't see or feel. They use special tools, x-rays, to check the bone levels around the implant.
To make sure the periimplantitis hasn't started.
Exactly. Or they check the torque on the little screws that connect the crown to the implant post. If those screws get even a little bit loose,
You're back to that micro-movement problem.
you are. And again, you might not feel any pain until the whole structure is already failing. Catching those little mechanical issues or early bone loss is everything for longevity.
And finally, that brings us to mistake number 5, overlooking the importance of nutrition. This feels like it brings the whole conversation full circle, back to the body's ability to heal.
It really does. People talk about a balanced diet, but the sources get very specific about what your body needs, especially during that healing phase.
We're not just eating for energy.
You're supplying the raw materials for bone and tissue repair.
So what are the key building blocks that people are often missing?
Well, the obvious ones are things like vitamin D and calcium for bone density. That's critical. But protein intake is also vital for regenerating tissue and keeping your immune system strong.
Right.
If you have a nutritional deficit, your body has to prioritize. It's going to send resources to keep your vital organs running, not to the slow, complex job of fusing bone to titanium. So focusing on nutrition isn't just general health advice, it's a specific strategy to maximize the success of your dental investment.
What I think we've really learned today is that dental implants are definitely not a set it and forget it kind of thing.
Not at all.
They're a complex, long-term biological investment. And avoiding these 5 mistakes, from, understanding the biomechanics of healing to knowing how your overall health impacts it, that's all within your control.
Completely. And that high level of patient involvement just shows how important that professional partnership is. For our listeners in the Arlington Heights area and the surrounding towns, whether it's Buffalo Grove or Schaumburg or Palatine,
Right.
consulting with an experienced team that really gets these systemic connections, like the one at Omni Dental and Medspa, is just paramount to guide you through this successfully.
So given how critically important systemic health is, things like immune function, inflammation, specific nutrient levels, for the success of a complex dental procedure like an implant, it raises a really interesting question for you, the listener, to think about. If the body needs to be so perfectly tuned and healthy after a surgery to make it work, how should we fundamentally change our approach to just general preventative oral health to better support the entire body before an intervention is ever needed? Think about it. Maybe the mouth isn't the problem, but the clearest sign of our health everywhere else.